Good afternoon, everyone. Thank you so much for joining us this afternoon. This is our fourth and final public policy webinar for this month. We usually join together in person on this day at the MSU Development Center, but we weren't able to do that this year due to the pandemic. So I'm glad everyone's joining online. So again, thank you. I want to thank everyone who's donated to our governmental affairs appeal this month. Every dollar helps to support us to continue to work on public policy here in Michigan so that people's lives are better who have disabilities. Today, our fourth and final presenter is Nicole Jorwic from the ARC of the United States. She's become one of our favorite presenters for our annual little public policy seminar that we do here in Michigan, and she's always gracious enough to attend. She's the director of the rights policy at the ARC US, and I want to thank her for joining us again this year. And so I'm going to turn it over to her. Thank you.
Thanks so much, Sherry. This is Nicole Jorwic, and actually I have a little bit different of a title from last year. I'm now the Senior Director of Public Policy at the ARC. Really glad to be joining you all virtually. I wish I was there in person. It's always one of my favorite chapter visits every year. As folks that know me may remember, I'm from Illinois originally, so I always feel most comfortable in the Midwest. Glad to be presenting today. Obviously, this presentation, when I was originally asked and earlier in the year, was going to look a little bit different. The main focus of what I'm going to talk about in the beginning is about the legislative response to COVID-19, to the pandemic, which is the reason that we're obviously all together virtually. And then I'm going to go through some other priority policy issues, because there will be a point in time at some point this year, most likely, that we will be able to circle back to some of our original goals. And also just kind of talking about more big picture, because there were some conversations that were going on the Hill that are now going to be exacerbated, or we're really having a highlight on a lot of the problems that we have going on because of in the disability service sector because of the pandemic. And sorry about that, my dog. Next slide, please. Next slide. COVID-19, it seems like it has been a center for a while, and sorry for barking. So it's hard to believe that it's only really been going on since March. I remember the day that the World Health Organization COVID-19 pandemic, because that was also that we had to make it really hard to cancel our disability policy center in Washington, D.C., where we had over 1,000 people registered. But obviously, the right thing to do. We want to put disabilities and their families at risk. We know that people with disabilities who are immunocompromised are at particular risk, facing high risk of complications, needing to isolate themselves, and all the complexities that brings with it. Next slide. So there have been several bills, and quickly I'm going to go through the bills that have passed so far. So there have been 4 bills. We're calling. Sorry, one second. I decided to get a dog during the pandemic, and it's mostly a good decision. Anyhow, during the course of the pandemic, there have been several legislative packages that have passed. The first one was really around was just around testing. The second was also was more health related, but it did include that 6.2%. That was the Families First Act, and it included a 6.2% FMAP or federal match bump for Medicaid. And so that, in theory, was meant to help the disability service section, although we've seen in every state that has gotten sucked up into general revenue fund. The third package was the CARES Act, and that passed on March 27th, 2020. Seems like a lifetime ago. And that bill is the one I'm going to. On this slide, we have the housing funding included in the CARES Act, including $15 million for housing for people with disabilities. In addition, there was $30.75 billion set aside for Education Stabilization Fund. And so it was not dedicated specifically to the needs of people with disabilities. However, the funding must be spent in accordance with the Individuals with Disabilities Education Act, or IDEA. The CARES Act also included the PPP, or Paycheck Protection Loan Program, and that is something that some service providers all over the country have been able to tap into as services go down. But it's just a real small drop in the bucket for the CARES Act also included a short-term reauthorization of the Money Follows the Person program. I'm going to talk about that, the Money Follows the Person program, later, but folks who have heard me present in the past, I've talked about this program that is used to out of institutional or nursing home settings and into the community. It's a short-term extension. There have been several, and we were not wanting another short-term extension, but it was better than none because it was set to expire. Also extended spousal impoverishment protection. The CARES Act also included a bill that allows for hospital support to be paid for direct support professionals to be in the hospital. This was not something that was COVID related. This was a bill that the ARC and other organizations had been working on for a long time. It just happened to be in that package. The state plan option that a state would have to pick to choose to pick up, choose to take advantage of, but it would allow for billing for direct support professionals in the hospital or had been considered double billing. So that is also something, and it did include also funding for the Administration for Community Living, but that's really was more directed at the aging side. Next slide.
Nicole, can I interrupt for 1 second? This is Emily. We're having a little bit of audio difficulty. We're not able to hear you totally clear. So looking at your computer, if there are any other windows or anything that you can close, and let's try camera off for a bit, and that might help with the bandwidth issue.
Okay, sure. Sorry about that.
All right, thank you.
Okay, hopefully that helps. And I also moved my computer. Let me know if there's any other difficulties. Does that sound better, Emily?
Yes, it does. Thank you.
Okay, thank you. And so I already talked about the housing funding and the education funding, but also there were pieces of the CARES Act that deals with unemployment. It expanded unemployment benefits, including for people with disabilities, and it also was very clear that for unemployment and also for the stimulus payments, which I believe are on the next slide. The stimulus payments that were included in the CARES Act, also sometimes called the recovery rebates, those are none of those, either unemployment or the stimulus money, should impact eligibility for Social Security or Medicaid or other means tested benefits. There had been a lot of trouble after this was passed. The IRS and Social Security did fix the problem, because originally there had been concerns around people who don't usually file taxes, filing taxes, but that was all resolved through administrative action from the Social Security Administration. Next slide. The third package, actually the second and third package, had different paid leave provisions. The second bill included paid sick days, paid sick time for employees, and it also the third package included paid leave. However, we have some concerns because many were left out. Caregivers who are not parents, so for example, myself as a sibling, or grandparents who might be caring for disabled adults or disabled children. There were too many exceptions to the paid leave, and so making sure that the provisions are for everyone is also something that we're working on getting fixed in the next package. Next slide. In the CARES Act, there were several pieces that we have been working on in the healthcare space in order to make sure that individuals could get larger supplies of their medication. So that was part of the CARES Act, was making sure that individuals could get that medication so they wouldn't have to go to the pharmacy too often because of obviously the risk of contracting COVID. We were hoping for a bit broader of support in the medication area, including allowances for controlled substances, because some seizure medications and other medications that people with IDD use are considered controlled substances. And so, but however, that wasn't in the federal bill, but I'm happy to say that there's been a lot of state level action in those areas. And so that issue is not something that we've heard popping up, but if you're hearing otherwise, please let me know during the next slide. Next slide. So what remains to be done? Unfortunately, a lot. My kind of line on the first three packages are that they really all but ignored the needs of people. The main ask that we are looking for is for dedicated home and community-based service funding, or HCBS funding. That is for Medicaid, the provision of Medicaid home and community-based services, including everything from job coaching, services in group homes, day support, and we know that those service areas are really struggling. And the funding, so the CARES Act that passed in March 27th, there was a version of that bill that was introduced by the Speaker of the House, Speaker Pelosi, that did include the HCBS funding, but unfortunately it didn't get over the finish line in the negotiations. And so in that version of the bill, the HCBS funding came in the form of grants. So it would have been grant funding to states. However, I'm gonna talk a little bit about the HEROES Act and talk about how that mechanism changed. But regardless, a line I've been using on the Hill is we're relatively agnostic to the mechanism for getting the money out the door. It just needs to get out the door. We're working on gaining bipartisan support. I actually just this week had a meeting with Senator Stabenow's office on this issue, and this funding is about a lot more than just supporting providers. That is an important aspect of it. Funding would also provide wage support and flexibility, retention and recruitment funding for the workforces, for the direct support workforce. It also would just broadly be about providing the services more generally. So it would ultimately obviously be going to states so that they can make sure that there is provision of home services. Home and community-based services are always important, but it's really important to note that because of the really high rates of infection of people with disabilities in more congregate settings like nursing homes and institutions in states that have them. I know in my home state of Illinois, the National Guard was called in because in 2 of the institutions that are still open there, over half of the residents were infected. And unfortunately, those types of stories are not getting media attention like the nursing home settings, but it does, again, bring to light why we need to have this dedicated home and community-based service funding. Next slide. Again, so the funding for HCBS could be used for things like retention and recruitment. It can be used for the provision of PPE and other medical supplies that direct support professionals may need to keep themselves and the individuals that they serve safe. We're really working to make sure that any definitions for workforce includes the workforce that also provides employment supports. We want to make sure that there's not too narrowing of a definition of the workforce so that everyone can be supported. Next slide. So our priority asks for package 4 have unfortunately been the same since the beginning of April. It's funding for a Medicaid grant program, but actually it's just dedicated funding for Medicaid home and community-based services, personal protective equipment for direct support professionals. Unfortunately, we've run into the issue of many folks not understanding the important work that direct support professionals do, and therefore a lack of understanding of the fact that this is an essential workforce by every definition of the word. And so that's another huge component of what we're working towards. Paid leave for caregivers and paid leave for all caregivers is something that's really important. And also making sure that there are no limitations or barriers to access to the economic impact payments for all people with disabilities. Next slide. So the HEROES Act. The HEROES Act passed on May 15th of 2020. It was a very large bill, and it includes over $3 trillion in coronavirus aid, including nearly $1 trillion for states and cities, also some hazard pay, but I'll get into that because I don't think that that's going to get through in what's negotiated. Senate Majority Leader McConnell has indicated that the Senate won't act until July. And I will say that things have pivoted. I got asked that question yesterday on a state exec call, and I think it's really important to note. When the bill passed in May, we knew that most likely the Senate side wouldn't start negotiating until after Memorial Day, but obviously we're well beyond that. And after Memorial Day, the calculations changed because that was, as folks may recall, when the really strong jobs report, well, not really strong, but stronger than anticipated jobs report, there weren't as many unemployment requests as had been thought. And so, and also the coronavirus cases all over the country were relatively stabilized. Unfortunately, that has shifted. And so now we are again hearing that there will be some action in July. I say that just because when the first week of June, when the pressure wasn't being felt by the majority leader, we were hearing things that it would even seep into September. And so I'm glad to report that it is sounding like we're gonna be looking at like July. Next slide. The HEROES Act included a lot of things that we had been working on and pushing for. It includes, I mentioned the 6.2% FMAP bump that was included in Families First, the second COVID relief bill. And the HEROES Act would provide that 6.2% through June 30th, and then bump that up to 14%. And so that would be a huge influx of funding to state Medicaid programs. And we know that state Medicaid programs are under a lot of stress right now. We're seeing state budgets that have big holes. And so we really want to not only see the HCBS funding, but also want to see the FMAP. The HEROES Act also did include that HCBS specific funding and included over $13 billion for home and community-based services in the form of an FMAP increase in lieu of a separate grant program. It would be a 10% FMAP, so 10% based on the whole Medicaid program. But it could only be used, it would be directed to be used on home and community-based services. This is a similar structure to the Money Follows the Person program, where there's money that goes to states based on an FMAP. And it would be a year of funding, so this isn't long. It's for 1 year to be used to support home and community-based services. And that would be for everything that I mentioned before, including workforce support, PPE, as well as just the general provision of community-based services, including diversion of people with disabilities and older adults from the more dangerous congregate settings. From a healthcare perspective, the HEROES Act includes a 2-month open enrollment period to allow individuals who are uninsured for whatever reason to enroll in coverage. Currently, Americans can only enroll in the Affordable Care Act plan during open enrollment periods, or because of a life qualifying event if they were previously insured. And so we really need to see that opened up. Next slide. There was another, even though there had been housing funding in prior bills, there was even more funding in this bill, including $200 million for Section 811 supported housing for people with disabilities. So that will be valuable to states as they're wanting to build home and community-based housing units. Section 811 has very good ratios with making sure that any units are integrated units. The HEROES Act also codified the regulatory requirement that state Medicaid programs cover non-emergency medical transportation, or NEMT. So it just puts that into law. It was a regulatory requirement, but there are some states that are unclear, so that is something that we're. Next slide. As far as education, there's an additional $100 billion to support the educational needs of states. And again, there's not specific earmarked funding for special education. However, anything provided must be provided with the full rights of IDEA. Next slide. The recovery rebates, it expands economic stimulus payments to adult dependents. So right now, there are adults with disabilities who may be claimed as dependents on their parents' taxes. And as of now, they haven't been eligible for the $500 recovery rebate. HEROES Act fixes that, and also codifies the fact that stimulus funding will not impact eligibility for programs like Social Security and Medicaid. Next slide. So what you can do, I'm sure everyone's on all of our listservs and have seen all of our action alerts, and I know that the ARC Michigan is putting those out, putting out their own as well. And it's really important to reach out to senators starting this weekend, but really starting anytime and keeping the pressure on. We know that senators are going to be home, even though it's a pandemic, and so we're not in any way asking anyone to go out and do anything. It's just a time where maybe reaching out to district offices makes a little bit more sense than reaching out to the DC office. We know that the bill that passed the House, the HEROES Act, is large, and it's definitely going to be narrowed before it passes the Senate. But we are hearing good things. But I say that in no way to say we need to keep the pressure off. But this is the last package, most likely, that's going to be relief. We might move into recovery packages, but that's remains to be seen. And so it's just really important, again, to ring the bell on the fact that people with disabilities, the workforce, and providers have really been left out of prior bills. Next slide. Next slide. Another issue that I wanted to raise in the Medicaid space that's timely right now is around Oklahoma's block grant proposal. Oklahoma, the Trump administration released guidance in January of 2020 that encouraged states to look at block granting Medicaid. And I'm going to talk a little bit, and folks that have heard me speak before have heard me talk about some of the concerns that we have and why we have concerns around block granting. Next slide. Oklahoma was the first to take the Trump administration up on their announcement. That announcement around block granting is called the Healthy Adult Opportunity Program. There is some in-state activity, but it's just really important. We've pushed out and gotten over 3,000 comments because it's really important that we're building the public record with Center for Medicare, Medicaid Services, or CMS, to understand that we cannot have any fundamental restructuring of the Medicaid program. Next slide. So why this matters, why I'm bringing it up, and why we've been driving comments is that we know that 1 in 5 people rely on Medicaid for healthcare, and that over 10 million people with disabilities rely on it for healthcare services and for long-term services and supports, or LTSS. Medicaid generally is critical to obviously fighting what's going on currently, but it's also critical generally to the lives of people with intellectual and developmental disabilities. And unfortunately, we have real concerns that Oklahoma's proposal is vague, and generally, if approved, it's creating a real simple path for states to do to move forward with per capita caps or block grants that would fundamentally change the program without a lot of information, and that's really something to take a stand on. Next slide. So just a little bit of a reminder on why we have to be particularly vigilant around any state that is looking at this. And I just wanted to also highlight, Oklahoma is the first state that took up the administration on the healthy adult opportunity, but there are also several states, Utah, Tennessee, that are looking at doing this at the state legislative level. And so it's really important that we make sure that whether it's through work requirements or through a block grant or per capita cap, that we're protecting the structure of the Medicaid program. And that structure is obviously a state and federal partnership where federal and state governments share actual costs of coverage. There's an agreement in each state on eligibility and what services and supports are provided, and that agreement is between the state Medicaid office and the Center for Medicare and Medicaid Services, or CMS. And on average, the matching rate across the states is 63%, but it's always above 50% or right at 50% for states like New York. Next slide. That Medicaid creates what we kind of think of as the Medicaid guarantee. It's a guarantee that a state government knows that they will get the determined matching rate for whatever they're spending on their Medicaid program, no matter the beneficiary, as long as the beneficiaries and the services fall within Medicaid law. All costs then, and that's an important guarantee for states, because it means that all costs, including costs that may come from public health emergencies, are shared between the state and federal government. Things like the opioid epidemic or the Flint water crisis, for example, and including breakthroughs in treatments. And it's a really important guarantee that any block granting, per capita cap, or even work requirement really changes that guarantee and changes that structure. Next slide. So we know that Medicaid is an important program overall, obviously in the time of a pandemic, but it's also really important to always remember that Medicaid is so much more than a health care program. Medicaid is the only game in town when it comes to providing long-term supports and services, and that includes those home and community-based services that are so important. I say it's the only game in town because Medicare does provide some of those LTSS, but only for a short stay, for like a 90-day stay for rehabilitation, or for a limited time for home health. Any sort of long-term LTSS, Medicaid is really the only game in town, unless you're part of the small percentage. I think less than 10% of people have long-term care insurance. So it's really important to protect the integrity of the Medicaid program, because that is the place that is the funding stream that funds supports and services that people with disabilities need to live safely in their communities. Next slide. This is just a lot more information on Medicaid generally. We know it's the largest insurer of the country. It's also something that's really important to note is that Medicaid is also is a very efficient program. There's not a lot of overhead, whether you're looking at the state or the federal level. But it's also important to note that it is a huge part of spending for both the federal government and the state government. And that means that, unfortunately, that's part of why we keep seeing proposals like this, because that also means that it has a large bullseye on it at all times. And a lot of that is because of the long-term services and supports aspect of it, component of it, because while people with disabilities and older adults are only about 20% of Medicaid beneficiaries or Medicaid recipients, the cost of long-term services and supports make up about 48% of the spending. And so those are really expensive services, and again, so that they get looked at very closely, and that's why we have to remain vigilant. Next slide. And so all of the proposals, whether it's the Tennessee proposal coming out of the state legislature, the Oklahoma proposal, all of those would be a fundamental restructuring of the program, and it would move it from being an entitlement program to states to being more of something that has to be constantly negotiated, which it already seems like it does now, and it would be based on a formulary that would be difficult to change. Next slide. And that will inevitably mean cuts. Next slide again, sorry. Any sort of restructuring, whether it's a cap or a block grant or a work requirement, all of those things act to destabilize the Medicaid program. Governors and state legislatures would have to figure out where to come up with money to replace the federal share. A per capita cap or a block grant, those are all determined based on a math equation. The consumer price index plus whatever percentage based on it varies based on the proposal, but none of them actually match the actual cost of services. And so that would mean that as years go by, those gaps would grow and grow, and that would mean that state budgets would have to make up the difference. And we know that even before this pandemic, that was an unlikely scenario. But when you have state budgets that are going to be incredibly stretched, it means that individuals will lose services. It means that waiting lists will grow. It means that eligibility will shrink. It means that the breadth of services may shrink, especially if there's no change to the institutional bias of Medicaid. And when I say institutional bias, I'm talking about the fact that the federal Medicaid law, this is about the federal law, has mandatory services and has optional services. The mandatory services are things like institutions in states that still have them, healthcare generally, prescription medication, doctor's visits. It also includes nursing homes as mandatory, and optional services are things like home and community-based services. And so there will be no choice for state governments if nothing changes in that institutional bias, whether it's because of a pandemic or because of a restructuring of the program. Those cuts come first to home and community-based services. And that's why all of this is so important. Next slide. Money Follows the Person is another program that gives additional federal funding to state Medicaid programs. Next slide. This program has been around since 2005. It's always been a bipartisan program. There's always been strong bipartisan support. It includes that enhanced FMAP, 100% of federal funds for that first year. We know that when we're transitioning individuals from nursing home settings or from institutional settings, that the most expensive part is that first year, because you might have parts of the year where you're setting up the community program while the individual is still being served somewhere else, and you need to be able to fund both. And so it provides that 100% match rate. And it has moved over 100,000 people out of nursing homes and into the community. Next slide. It expired officially on September 30th of 2016. However, the transitions have been able to continue because we have gotten, at this point, 5 short-term extensions, which is very frustrating. But I am happy to say, I think it's on the next slide, there was, next slide. There was there have been short-term extensions, and then a 4.5-year extension passed the House last June. And then last December, the 2 chairs of the Senate Finance Committee, Majority Chair Senator Grassley from Iowa and Minority Chair Senator Wyden from Oregon, introduced a bill in December that would have made the program permanent. And so we do still have that on our radar and still have that on in our sights for when the next short-term reauthorization ends. And I mentioned that earlier, that ends November 30th of this year. Next slide. The HCBS Infrastructure Act is another bill that we were working on a lot before this all happened. Actually, the Senate version of the HCBS Infrastructure Act, it's actually the HCBS Infrastructure Incentive Act in the Senate, was introduced in February. Next slide. The ultimate goal and ultimate point of the rule is to get states funding to support what is needed to support states for the implementation of the HCBS settings rule, or the Home and Community-Based Services settings rule. It would include funding. States can make a choice on how to use the funding. It would be a 7-year grant program meant for every state to have eligibility to use the funding in developing housing, employment, workforce supports, and case management. Because the Home and Community-Based Services HCBS Infrastructure Act is based on the Balancing Incentive Program. The Balancing Incentive Program was a piece of legislation that passed as part of the Affordable Care Act, and it gave the states pretty wide breadth in what to spend the funding on. A lot of it was around case management and employment, and so case management is really a proof from that prior legislation. But we intentionally put some more guardrails, but not too many guardrails. There's still a lot of flexibilities for states because the Balancing Incentive Program really had so much flexibility that it was hard to study after. And so making sure that we can study the results that we're seeing at the state levels and working in these areas. Next slide. In terms of housing and employment, the funding could be used for building capacity, whether that's building units or building additional capacity for supported employment, or expanding programs that are already showing promise at the state level. The continued focus in the employment settings would be expansion for capacity and infrastructure for competitive integrated employment. Next slide. For transportation and workforce, the funding can be used for, we know that people with disabilities, whether it's for community integration or for community employment, access to transportation is an extremely important piece, and unfortunately is a big barrier. And so provision of transportation supports something the states could use the funding for, as well as whether it can be for the workforce, it could be that the funding could go towards a rate increase for pay, it could go towards retention and recruitment. That will be up to the state to determine. Next slide. So I mentioned the institutional bias in the Medicaid program. And I also mentioned that right now what we're seeing is that whether it's nursing homes or institutions that are still open for people with disabilities, right now we're seeing, in fact, that they are public health concerns. And so we had been having some conversations, including with Representative Dingell's office in Michigan, around, this was last September that we started having these conversations. So this was well in advance of about, how can we make home and community-based services mandatory? And I think that those conversations have been unfortunately bolstered by the concerns that we're seeing in some of those institutional settings right now. Next slide. So we will see some piece of legislation introduced, I would guess, by the end of the year, that is going to be really a marker because it will be introduced without the thought that it would pass quickly, because it will have a large price tag. We know from a score that we got from the congressional budget in 2017 that the cost of making community services mandatory would be over $100 billion. And so that's a very large investment, and that's obviously the size of the waiting list. We do expect a bill to be out there, and that will be the biggest piece of legislation that will be introduced in the disability space. And so it will hopefully be something that we can galvanize around and see if we can really get some federal investment, federal support, so that every state, Michigan did a long time ago, make sure that there's no more institutions, but also to move individuals who are in ICFs and nursing homes into community settings if they choose to. In the employment space, there is the Transition to Competitive Integrated Employment Act that's out there. That is the bill that it was the first time that eliminating the 14C, which is the part of the Fair Labor Standard Act that allows people to be paid less than people without disabilities. It pairs that with funding for transitioning services from facility-based to community-based. That is not a bill that the ARC of the United States has a position on. That we do in our position statement support the elimination of sub-minimum wage, but only if the individuals who would be impacted are wouldn't be, or that, so only that individuals currently served wouldn't be impacted. And the funding in that bill only has funding for 10 states. If it had funding for all states, that's how you'd make sure that there's enough funding to again have the capacity for those services. Next slide. Next slide. WIOA, the Workforce Innovation and Opportunity Act, passed in 2014. There had started to be some conversations about a reauthorization. I'm guessing that that's going to be kicked at least till next Congress. But it's always important to remember that WIOA is out there. It was the first time that there was a statutory definition of what competitive integrated employment is. Next slide. Next slide, sorry. There have been some challenges to the Workforce Innovation and Opportunity Act, including efforts to impact regulatory changes. The Department of Education oversees the Workforce Innovation and Opportunity Act. And there had been some regulations that came out that some felt like needed to be clarified. However, the ARC has worked with several other disability stakeholders to say that there might be some additional guidance or FAQs, but we don't need to reopen the regulations for a law that at this point is over 6 years old. And so we will continue. At this point, we don't believe that that will occur. Next slide. Oh, next slide, I already talked about that. Oh, powered through that in 45 minutes. So that's all the content that I have, but I would imagine there's going to be a lot of time for questions. I was planning to leave a half hour. I left a little bit more, but I will open it up and happy to answer any and all questions that you have.
Thank you, Nicole. We have 2 questions so far, and if anybody else has questions, you can type in the GoToWebinar chat window and I will relay them to Nicole. So the first question, has Michigan made those Medicaid provisions that you had talked about as far as like the 90-day refill on medications?
I'll have to look into that and get back to you. I don't know what every state has done. Sorry. I'll look into it.
Thank you. All right. Next we have a comment that says, thank you for the YouTube policy update videos. This person finds them very helpful. Now on to their question.
Thank you.
When they've attended, this person says they've attended a few town halls with Michigan congressional members over the past month or 2, and our more conservative members are saying that they can't support any additional funding bills until our governor shows how all the previous federal money was spent. Our attendee goes on to say that this is difficult to do because regulations lag, the money's only started to flow, etc. So do you have any advocacy suggestions? Michigan, like most other states, have an impending state deficit.
Yeah.
And resources are needed now before the state budget in October.
Yeah, so that's there. I've heard that issue before around whether it's from federal legislators or from state around, where is the CARES Act? Where has the CARES Act money already been spent? But I see something in the chat. Sherry wrote that Governor Whitmore may have a 90-day order on the refill, so we'll check. But I think that ultimately, whether it's the funding that the states have gotten, we know that that money has not flowed to home and community-based services. And also there's something called the Provider Relief Fund that was funded through the CARES Act. And that has been a mess, is an understatement. And so some of the federal legislators were like, well, we should see how that money goes out first. But because it's been such a mess, and because the needs in the state are so big, it's just really important to pivot and make sure that it's clear. As far as talking points, you know, we know that the targeted enhanced FMAP will help stave off budget cuts to the Medicaid programs that don't have any money right now, regardless of that funding. States provide those services by funding providers, but you know, it's about the state having the money that they need so that people don't end up in those more congregate settings. And it's also never a bad thing to remind folks that that community-based settings provide better outcomes and also are more cost efficient. We have data from the Money Follows the Person program, for example, and nationally we have data that shows that the average for serving an individual in an institutional setting is over $200,000 per year, where serving an individual on average in the community is about $65,000, although I would argue that it should be higher so that we can pay people more. But regardless, we do have data from MFP that per Medicaid beneficiary per month serving people in the community was 20% less every month. And so just reminding folks that this is an efficient way to spend money, and that you know, I hate to say this, but these are things that I say when I'm meeting with legislators, is that, you know, when you're telling people to wait and see, or wait to see how CARES money is spent, or what happens with the next tranche of provider relief money, the fact of the matter is, whether it's workforce or individuals we're serving, it's going to come at the cost of individuals' lives. And so, not to be so blunt, but to be blunt, that's really some of the talking points that I use. But also, it's important to ask the governor's office and the state Medicaid office if they haven't spent all those CARES dollars. For example, the Pennsylvania governor released over $200 million of the CARES money that Pennsylvania got to the disability system. So that is a way to actually ask for money if it hasn't already been spent.
Right, that is all of our questions for today. Thank you, Nicole, for your presentation and for those powerful advocacy tips that you shared. Thank you, everybody, for attending this week's Disability Policy Webinar Series presented by the ARC Michigan. This concludes our 4-part webinar series on disability policy updates for 2020. You can find the recordings of these webinars on our website at arcmi.org or on our YouTube channel. After this webinar is over, an email will be sent to all participants containing the information for the past 4 weeks. So thank you and have a great day.